So you've mastered the short arm cast, and now you're ready for the long arm cast application. These casts are appropriate for any forearm injury which needs to limit the rotation. It's also important to use these in kids under the age of 2 where their chubby arms may not be suitable for a below elbow cast. Any injuries at the elbow or the distal humerus are particularly necessary to use long arm casts. There are some typical supplies, as noted here, that can be utilized in the process of putting together a set in preparation for placing the long arm cast. Clearly, there's differences in the needs based on the age of the patient. If they're under 2 years old, between 2 and 4 years old, 4 and 7 years old, 7 and 10, or above the age of 10. All these children will have various needs in terms of the supplies necessary. You will then need an assistant that can hold the arm in the appropriate position. 90 degrees is a safe position for many patients. However, if there's significant amount of swelling, you may want to have the elbow bent only to 80 degrees or even 70 degrees. If the elbow is only at 80 degrees of flexion or less, you should consider using a hanging arm type cast wherein a cuff and collar is utilized, because otherwise there's risk for the cast to have issues with that extension at the elbow. Once you've determined the appropriate amount of flexion, you will then proceed with placement of the cast. Ultimately, the way that you determine that flexion is based on the amount of swelling at the elbow. You don't want to see a crease. We then proceed by placing some bias cut stockinette. Usually this can be done in such a fashion where you're placing some up on the humerus and some out over the fingers. Once you've determined whether or not you're going to use the stockinette, it's important not to have too much, because if you cover the entirety of the arm, you oftentimes can have some difficulty in terms of compartment syndromes and things like that. You want to make sure that you know where the knuckles are at the hand as you're placing the bias cut stockinette, and you want the holder to hold the fingers in such a way that it does not interfere with the application of the web roll or the cotton. Remember that the entire time the elbow needs to be held at the appropriate position, and you should not be changing it from a flexion to extension type position, as this will allow for bunching of the web roll at the elbow, which is inappropriate. You want to have 1.5 layers as you proceed forward on the wrapping of the cotton. You want to put more over the dorsal side of the elbow rather than over the antecubital fossa. You do this by breaking the web roll. There's no need to continue to roll it and making it thick anteriorly over the antecubital fossa. Usually you want to have at least 3 layers at each end, whether it's at the fingers or at the proximal humerus. You want to make sure that it's longer over the outer side of the proximal humerus and shorter near the axilla so that the cast doesn't impinge on the axilla. Once you've determined that you've placed the appropriate amount of web roll, you can then take some doubled over layers and place it over the ends, including at the knuckles, over the thumb, and then as well over the proximal humerus. This just increases the amount of padding in this area so that the end of the cast does not dig into the patient's arm. Again, you want to make sure that the elbow is maintained in that perfect 90-degree position, or whatever amount of flexion you determined was appropriate based on the swelling. The initial run between the thumb and the fingers should be a bunched up portion of the fiberglass rather than any cut fiberglass. At the elbow, you're going to go back and forth over the elbow because at the outer side there's more space and you don't want to over thicken the cast on the antecubital fossa side. You'll then have 3 runs at the proximal humerus. Fold down the bias cut stockinette on both the humerus and the fingers, being sure that all the knuckles are shown so that the patient has full function of their hand. There are various ways to get protection at the thumb. You can see here how we just cut an extra hole and folded it over. You can also take a smaller piece of bias cut stockinette and place it over the thumb as well. You then proceed to place a second layer. You can see here we're using a 2-inch fiberglass versus the 4-inch that was placed initially. This helps everything lay down nice and smooth. This time, as we pass through the space between the thumb and the first finger, we will cut a small wedge into it, just like we did on the short arm cast, folding over the frayed ends, as you see here. That way there's no rough edges to rub on the patient. We'll do this twice so that you'll have two of these thin layers as well as the one bunched up layer running through that first web space so that it's nice and sturdy and it won't break when the patient comes back at 1 week time. We continue not to put any excess fiberglass over the antecubital space, and then we proceed to do our molding. We want to be sure that we're doing squared off molding at the forearm as well as squared off molding at the humerus. We don't want to use our fingers. We want to use the palms of our hands. We want to have a straight ulnar board, or as you see here. There's various ways to achieve this. One of those ways is to use perhaps a box of gloves, which you will see here. This helps us maintain that nice reduction, particularly for a forearm fracture. Moreover, we want to make sure that our holder is not increasing the flexion or extension of the elbow. We want to maintain what we started with. We also want to squeeze in on the medial and lateral sides of the humerus so that the cast doesn't slide off from the elbow. We want to make sure we do our interosseous molds. All these things need to be done all at the same time so we do not lose our reduction and we maintain a good and excellent cast. Thank you.